Well, we've had a big focus on the show in recent weeks, as we always do, on climate change and its effect on local communities. We were in the Torres Strait last week, where the climate change crisis really is at the doorstep for so many islands there. It's often seen as an environmental or an economic issue, but of course it's also a major health threat. And to walk us through it is paediatrician and infectious diseases expert, Dr. Lenny Fung. Good to see you, Lenny.
Hey.
As we say, people think, oh, what's going to be the effect on our environment, on the sea level rise or the rising heat temperatures, but this is already becoming a major health issue.
Yeah, that's exactly right. I think, as you said, I think a lot of people think about climate change as like the melting ice caps, and they think about, just the bushfires, but we are actually already seeing the effects at the moment in terms of the effects on our bodies, the effects on the healthcare system. So think about sort of longer, hot, like heat waves, the hotter nights, the bushfire smokes and the flooding and all the disease that's kind of brought in terms of worsening of asthma, people with chronic disease being hospitalised, and then some of the outbreaks that you guys covered at the start of the year in terms of melioidosis in Queensland, for example. So there are already effects that we are seeing, and I think that people kind of, separate the two and don't think about how intricately linked these two issues are.
It's really interesting because over summer I'm much more conscious now of always travelling with my asthma medication, which I never would have done in the past, just because of experience getting caught out without it and there being a bushfire nearby. Right. Who's at most at risk? Is it usually the young and the elderly in this scenario?
Yeah, that's exactly right. So often we think about sort of the extremes of age, so the very young, the older adults who have chronic health diseases, so heart, lung, kidney diseases in particular, pregnant women. We also think about First Nations people and regional, remote and low-income households, because obviously these individuals can often be more exposed to the elements and have sort of less infrastructure protecting them from the, the extremes of climate, and then also decreased access in terms of healthcare and healthcare services. So that can be a real big problem as well.
Yeah, you go to some remote areas in the centre of Australia and it can get up to 50 degrees, even higher inside the house, where there's very, very scarce energy security, and energy poverty is a huge issue. What would keeping carbon emissions down and hitting our targets mean for our healthcare? This was a big discussion last week in terms of just the commitments we've made, but what would be the demonstrable effects for health?
Yeah, I think this is really important. So the government's committed 62 to 70% decrease in emissions by 2035, but from a health perspective, we think about, hopefully less hospitalisations of children with asthma, hopefully less adults being hospitalised with chronic heart, lung, kidney disease issues, lower infectious diseases spread. So from my perspective, we're seeing more dengue fever, we're seeing Japanese encephalitis head south. So it used to be sort of far north Queensland and up above, whereas now we saw stuff in Victoria. Some of that soil and waterborne disease, as we were saying, even gastro-related illnesses can be affected. And so I think just, we talk about these climate changes in these numbers, and that report the other day essentially talked about a 3-degree rise in temperatures causing up to a fourfold increase in heat-related deaths in Sydney and over a 2-fold risk in Melbourne. So there are the more we're able to reduce and do now, the better protected we are going to be for the future, which I think is really important, obviously.
Yeah. Before we let you go, anytime there's an emergency, authorities are really clear. They say if you get prepared and you are ready for any eventuality, you'll probably be fine. Generally, it's the people who drive through floodwaters, people who don't make a bushfire plan that get caught out. So what should we be all doing now ahead of the warmer months?
Yeah, well, I think some of the points that you raised earlier, James, so, having your asthma puffer, for example, so just kind of being prepared, having your puffers and your other essential medications on hand, particularly during those smoky days or hot weather, making sure that we stay hydrated and keep cool, keep indoors during those heat waves, checking on elderly sort of neighbours, friends, relatives and pregnant women during, again, those sort of climate extremes. And having some of those apps as well can be quite handy. So the Air Smart app is quite good by Asthma Australia to look at air quality and thinking about whether or not it's going to be a bad day in terms of pollen or smoke. And those state emergency apps as well are obviously really critical sort of information, timely as well. I think just in terms of what we should be asking governments for, though, I think it's really important that we think about sort of long-term sustainable housing and, as you mentioned, Bridget, just making sure that they can withstand extreme heat and climate events, making sure that there's really good early warning systems that are available to be able to predict some of these heat waves and some of these disasters that are coming. And then the last thing is really investing in hospital infrastructure to make sure that, you know, our already stressed and overburdened healthcare systems are able to deal with that influx of all the extra climate stuff and then the, you know, the usual day-to-day busyness.
All right, Lini, we always love your advice. Thank you very much for that.
Thank you. Thanks.